We're watching Spotlight Chicago, presented by UI Health with Sarah Jindra and Ji Suk Yi.
About 1 in every 1,600 babies in the U.S. are born with cleft lip or palate or both.
That's why UI Health's Cleft Craniofacial Center, easy for me to say, has spent 75 years caring for adults and children with cleft deformities, helping more people enjoy an improved quality of life. Dr. Julie Corcoran joining us now with more. Thank you so much for being here.
Well, thank you for having me.
Give us an idea of what exactly a cleft palate is and how it becomes, I guess, part of the person when they're born.
Yeah, so cleft lip and cleft palate is something that happens developmentally. It's usually happening at around 4 to 6 weeks into pregnancy. So just as most of these women are figuring out they're pregnant. And basically, as all of the pieces and parts come together to make that face, as something's early or something's late or it doesn't stick, we get a separation between the lip and the nose and they become one and the same. That's the cleft.
I had no idea that it was that early in a pregnancy. So are there certain things that you can do early on to kind of prepare for then when the baby is born?
Sure. I mean, general good health as part of planning, family planning, you know, if you know you're ready to have kids, to make sure you're doing things like taking your vitamins and not spending too much time having too much fun with alcohol and cigarettes. Those are always good things when you're planning.
We had talked very briefly about, are we seeing this more often or less over the past 10 or 20 years? And you had a very fascinating answer about that, and also the solutions for it as well.
Yeah. So when I went to medical school, which was in the last century, but we were quoting 1 in 700 births in the United States, and you just gave the correct figure, which is 1 in 1,600. A lot of this is due to just better information, people being healthier, better fed, taking prenatal vitamins, avoiding things that they shouldn't be doing. And so much of this is really just a matter of better health in the United States.
So do you know then when you're having a child, do you just find out right when the baby is born, or would you know ahead of time that you might be dealing with this in your future?
Yeah. So when you have a cleft lip and a cleft palate, the lip portion is out on the outside of the face. So that 20-week ultrasound that most women have during their pregnancy would catch cleft lip. And that helps us know and coach people through the second part of their pregnancy about what to expect and be ready for this.
So kids that have this deformity, what are the procedures, what things can be done?
Sure. We repair them in stages, and you know, not everybody has the exact same thing. You know, you were alluding to that a little bit earlier. But, you know, we typically spend the first bits of just working with babies and making sure that they can feed and that they grow and that they're healthy. And somewhere around 3 to 5 months, we'll get ready to repair the lip and the outside of the nose. And then around 9 to 12 months, we'll repair the palate as the adult teeth are coming in. So I think about 6-year-old molars and 12-year-old molars. As those adult teeth are coming in, we'll fix the gum line. And then once the face is finished growing, we'll do final reconstruction of the nasals.
So this is something that it's not just one surgery and you're in and out. So it's important to have a team that you trust.
Absolutely. It's a journey. It's a journey. And, you know, as much as I get some really warm, fuzzy, dramatic moments as the surgeon, there are so many other people on the team that you spend so much more time with. Our speech pathologists and our nurses who help the families initially learn how to do the feeding, how to learn how to use these palatal muscles we give so that they can speak clearly and have their message heard by people. Our pediatric dentists and the orthodontists who help line up all of these teeth. This is not, you know, this isn't one and, you know, it's not only one and done, but it's not one person and done. It is an entire team. And actually team care is what the American Cleft Palate Association actually advocates for, and it is the standard of care.
And so you've run the gamut at UIC. Can you give us an idea of like how long surgeries can take, how intensive they can be from, I guess, very light to very severe?
Well, I think, you know, intensity of surgery, how it's perceived by those of us who are not having the surgery. Any surgery you have, if you're the person having surgery, it's a big deal. right? But I think, you know, when you sort of think about this is, you know, how much does this affect somebody's life day to day? Most of these surgeries that we do for kids, they're real surgeries. We're in the operating room, the patients are asleep, but most of them go home with their family and recuperate in their own bed that same night or one night later.
That's great.
And so, you know, it's a real surgery, it's a real recuperation, but, you know, most of these kids, you know, they have episodes in the hospital. They get most of their life in grade school and on the fields and in art classes and whatever it is that makes them growing up to be the person they're going to be.
And be where they should be, yes.
Exactly.
So what are you hearing from parents who are working with this full team?
I think one of the things is that it's really reassuring to people to know that they have people that they can rely on. And so, you know, when you have somebody who's having a speech problem and the school speech pathologist says, you know, wow, what's going on? And they say, well, I have a speech pathologist you can talk to and we can work on this together. So it allows things to cross into their real life. It gives them a whole set of people that they can count on.
How life-changing, when addressed appropriately, are these surgeries?
Well, I personally, this is a personal thing. I think of cleft lip and palate as a communications disorder. We want to have that lip and the nose put together so people aren't looking what's going on with this person, so that they're actually then hearing what this person has to say and that their speech is clear and strong so that their message comes out. And so ultimately being able to go and put your best face forward and have yourself heard, there's no gift that's greater.
Oh, Dr. Corcoran, thank you so much for being here. We appreciate it. You can get more information from the QR code right there on your screen. You can also head to uihealth.care. Find them on the socials as well.